Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will going to help you. So, continuing with the neurological disorders in Panchakarma treatment in children. So today we will discuss about role of Lepana Karma. Now, Lepana is a local method to decrease the hypertonicity. And after doing the Lepana, there will be symptomatic relief at the individual muscle level. And if it is applied generalized all over the body, it can give the generalized muscle relaxing. Which type of the Lepana has to be followed is very typical. That is Alepa type, which is having a moderate character, is always good. Now when you are doing the Lepana with Ushna and Tikshna drugs, it will going to stimulate the free nerve endings and also continuously give the stimulation of Tikshnatva, Ushnatva, heat sensation, pain sensation, etc. And this will be carried to the sensory cortex, which induces modifications in the brain parenchyma and brings the neuroplasticity. Lepana may be also useful locally at the skeletal muscle level. Skeletal muscles, in the skeletal muscles we have M receptors, neurotransmitters, which contains the acetylcholine neurotransmitter. So Lepa of the drugs containing certain acetylcholine receptor blockers, when applied locally, can ensure some temporary relief, causing anticholinergic activity. The Lepa of the Datura, Lepa of the pilocarpine, belladonna alkaloids, so Shirisha Patra Lepa, Bruhati Patra Lepa, can be quite helpful in certain conditions. One more method of Lepana is Agni Lepa. It is also called as Agni Chikitsa. Actually, this Agni Lepa is commonly practiced in Flocor medications, and originally this idea was taken from a paralysis center which is present near Ankola, Karnataka Maharashtra border. Traditional method. My teachers of SDM Udupi and our respected teachers, so they visited this particular Flocor place and collected the information. Then they successfully implemented this Agni Lepa or Agni Chikitsa in the routine care of paralytic patients. So this is usually done prior to the Shodhana therapy. For inducing the Deepana, Pachana and Agni Vardhana and Amanashaka property, this will be given. So same practice I was doing in, I have been practicing the same method in cerebral palsy patients and some other neurological patients, and even in case of autism, in a spasticity, for treating the spasticity, and in autism again for the purpose of neuroplasticity. And how to do this? Yes, drugs which are present in this Agni Lepa is very typical. It contains wet drugs and also it contains dry drugs. The wet drugs which are present is Eranda, Nirgundi, Agnimanta, Vana Tulasi and Bandhaka, etc. The dry drugs which are present is Lashuna, Haridra, Lavanga and Sarshapa. Sarshapa is 1/4 teaspoon and Maricha is 1 teaspoon. And its Lepa is prepared, and this Lepa is applied on the opposite direction of the hair. So usually if possible 1 to 2 grams can be even given orally also, because it has got Deepana and Prachana property and Amanashaka property. This method is quite useful and can be applied locally or in a generalized way. This helps to clearing the Shrotas and remove the daily collection of the Ama. Of course, the drugs by the virtue of their virya etc. also stimulate the sensory cortex and locally acts on acetylcholine receptors. One more method is Udvartana. Now Udvartana is Kafahara and Medasa Pravelayana. So basically Udvartana is good for Medasa Avrata Vata. Snigdha Udvartana, Ruksha Udvartana is there. So Ruksha Udvartana is more preferred here. Or maybe Snigdha Udvartana can be done. Many practitioners elsewhere in the country, so they practice Udvartana in the treatment of cerebral palsy, especially considering Kapha Vriddhi like condition for the spasticity. Spasticity condition they consider as Kapha Vriddhi, and for the Kapha Vriddhi they will go for Ruksha Udvartana. This is what their concept. But when we look into the pathology exactly, but pathology in the brain is clearly suggestive of Vata Vriddhi. So going for Ruksha Udvartana, when already there is Vata Vriddhi is there, so it may lead to some other problems. However, it depends upon their concepts. So personally, I will not go with Udvartana. So, but it is predominantly practiced Udvartana method. This is a method. So next we will go for Svedana. Now how to do the Svedana? Svedana, we know that Ushna Guna is always Vatahara and Snigdha Guna is always Vatahara. Amla Rasa and Lavana Rasa is also Vatahara. This is the basic thing. And all the Svedana procedures are formulated basing these, keeping these 3 points in view. Now Mrudu Sveda is indicated as cerebral palsy like debilitating disorders is there. It's a debilitating disorder, therefore Mrudu Sveda is indicated. Niragni Sveda like conditions can be also indicated like Ushma Svedana at conditions. Svedana is not for the Shodhana purpose. We know that here in this case neurological problems, Svedana is done only to cause the Mardhatva of the Anga. Although we are not giving any Shodhana procedures later onwards, still we will go for Svedana because it brings the clears the Shrotas and brings the Mardhatva of the Angas. So once the Mardhatva of the Anga is achieved, spasticity like conditions, hypertonicity like conditions can be corrected to some extent. So Hasta Sveda and Pata Sveda can be used. Even Valuka Sveda can be also used cautiously. So hypertonia is one which is marked by Stamba, Gaurava, etc. And indication of the Svedana, Stamba Gaurava Shitagnam. Therefore, to reduce the spasticity, we mostly go for Svedana. Snehana and Svedana are known to bend even the Shushka stick also, dry stick also. So Svedana drugs are generally having Ushna, Tishna, Sara, Snigdha, Ruksha and Sukshma and Drava, Stira, Guru properties according to Charaka Sutrasana 22nd chapter. In general, the Sveda Dravyas for Vata Kafaja Roga, suppose the Roga is Vata Kafaja Roga, Varuna, Guduchi, Shiguru, Mulaka, Sarshapa, Vasa, Vamshi, Tulasi, Brihati, Panchamulas, then Karanja, Ashmantaka, Malati, Gandatrina. So these are basically used. Some of the Svedopanaga drugs, those drugs which induce Svedana. Okay, so like Shiguru, Eranda, Shweta Panarnava, Rakta Panarnava, Arka, Yava, Kola, Kulata, Tila and Masha. So we can make use of all these drugs in the total procedure of Svedana wherever it is required. Now what is the role of Svedana in hypertonicity? Now Svedana has got a very good role in both locally and as well as generally in reducing the hypertonicity. Locally it causes the Mardhavatva of the muscle and relax the Stamba and Stamba will be get relieved. Otherwise, Svedana is doing the vasodilatation of the vessels which increases circulation. It clears the Shrotoroda, Ama will be cleared and other drug or procedures can have better effect after cleansing the Shrotas. So Svedana is also imparts the temperature. During Svedana, we will have temperature sensation also. The nerve endings of the pain and temperature are stimulated and sensory input into the brain will be increased which can help to modulate the motor functions or to bring the neuroplasticity effect. And we know the different types of Svedana is mentioned. Now Kola Kulattadi Pinda Sveda, Shashtikshali Pinda Sveda, Churna Pinda Sveda, Valuka Sveda, Jambhira Phala Pinda Sveda and Patra Pinda Sveda can be used. This is the Svedana procedure. One of the Svedana which is used is Upanaha Sveda. So practically this is quite convenient to use Upanaha Sveda in children and can be applied for longer hours also. Other Svedas you cannot apply for longer hours, but Upanaha Sveda can be applied for longer hours. It is done with a paste of Vatahara drugs and mixed with the Amla Rasa drugs. Amla is best Vatahara. So Amla Rasa drugs which with more and salt. Lavana is also Vatahara. With more salt as well as fat to make it more snigdha. The paste which is prepared by Vacha, Shatapushpa, Kushta, Devadaru, Rasna, Eranda, Mamsa, Sneha, Lavana and Amla Dravya is applied over the thin cloth and wrapped around the involved muscles. And this is also useful in contractures if it is developing. Okay, also it prevents the development of the contractures. So nowadays same modification of the Upanaha Sneha Sveda can be done as pattabandhana. Same materials are taken and then it is applied over the thin cloth, and then it is first applied and then paste was done. Then it is covered by the eranda leaves and tied tightly in the area where there is hypertonicity is there or contracture etc. is there. So it also works as pattabandhana. I will show the picture later. One more method is Salvana Upanaha Sveda. Lavana Upanaha. It is again the modification of Upanaha Sveda only, but Salavana, more with the salt. Salt is again Vata. Salavana Upanaha Sveda, that is Upanaha mixture which is very rich in salt. Salt is Vishandana, Vatahara, etc. So Upanaha mixture contains Kakolyadi Gana drugs and some of the Vatahara drugs, Amla Rasa drugs, then Anupamamsa, Sneha, and more amount of Lavana. It helps in relieving the pain and contractures and also spasm. It helps in relieving the sankocha, spasticity. Mostly, this Salavana Upanaha Sveda is given for Kevala Vataja Rogas. Kevala Vataja Rogas. So one more method is Pinda Sveda. Now Pinda Sveda we can follow by Jambira Potali Pinda Sveda, which is quite good in Amavata, muscular cramps, Avabahuka, stiffness of the joints, etc. Another one is Patra Pinda Sveda, which is quite good in Katishula, joint contractures, stiff joints, etc. Another is Dhanyamla Potali Pinda Sveda. Okay, Dhanya Potali Pinda Sveda. This is also good in painful contractions. Churna Pinda Sveda is also useful. This is quite good in Vata Kapha disorders. Kola Kulatadi Potali Sveda. This is commonly used and this is good for all the Vata rogas. Kola, Kulata, Amrataru, Yava, Mishi, Masha, Atasi, Kushta, Rasna, Tailafala, Narikela, Sarshapa and Karpasa. These drugs are taken. 16 parts of the Amla Kanji is taken and liquid is evaporated, and the last the underneath mixture is taken, solid part, and that is mixed with the above drugs, and then it is applied. This is called as Kola Kulatadi Potali Sveda. Similarly, you can also prepare Karpasa Bija Pinda Sveda. This is Kukutanda Sveda. One of the method how by using the egg Kukutanda we can make the Svedana material. So these are the different types of Svedana which can be practiced according to the situation. We can do so many modifications here. In the next class, we shall discuss about role of Shirodhara in neurological problems. Thank you very much.